Hello, my name is Todd Work, and today I will be interviewing Sharon Cisneros, a registered nurse, about a variety of subjects relating to what constitutes effective medical professional relationships and patient medical provider relationships and her related experiences therein. Sharon, how long have you been a nurse?
Well, Todd, I've been a nurse now for about 30 years. This would mark my 30th year in nursing.
What qualities do you think are endemic and comprise, a good nurse?
Well, Todd, a lot of times now, these days, people are just getting into the nursing profession just based on the economy. But I think there has to be something inherent in the individual that has some sort of compassion and somebody that wants to do for others what they cannot do for themselves. A lot of times what makes a good nurse is somebody that has gone through some hardships in their life or even tragedies. Sometimes people may not think that these make good nurses, but a lot of times that gives them empathy, that gives them a compassion that is needed in a patient-centered environment. People have more understanding when they can relate to a patient's situations, and they can get more on their level a lot of times through hardships and through difficult times because it is a very patient and relational type of job 24/7. So I'm not saying that every nurse has to have a tragedy, but people that are caring and compassionate and want to help their fellow man.
What brought you into the field of nursing?
Well, going along that concern, my own background kind of brought me in. My mom was a house invalid, and being the middle child, I was kind of inherited that position as a caretaker. And when you love somebody, you don't mind filling that position and picking up the slack and helping where you can, whether that means helping in simple things, learning to prepare meals, or learning to help with activities of daily living. Sometimes, you have family members, grandmothers that need feeding, or people that you love that makes you have to pick up the torch. So that's where I was, and not only my mom being a house invalid, but there was something endemic inside of me for taking care of people, even at a young age. Probably today people couldn't relate, but when I was 13, I even volunteered in the nursing home. I would go and visit people in the nursing home, and I would see that they had no family members or nobody would come to visit them. And it would start out by maybe a little lady had long hair and it was matted, and I'd go and help her for an hour or two, shampoo her hair, make her feel better, and brush out her hair. Or it could be somebody that didn't have any family members, and I'd sit there and read a simple story to them. And after coming regularly, you could see that these patients really depended on you, and that they would spark up and they would smile, and they, even if they couldn't remember your name, they would see you and they would remember you and look forward to the visit. And so those are the kind of things that would motivate me, because there is intrinsic rewards. It's not always financial, but it's a sense of being there and being present, and you get out of it what you give to other people, and when you can see the positive effect that you make on others. And I think those are the qualities that make a good nurse.
So it would be fair to say that your experiences with compassion, duty, and loyalty, and seeing that others need some sort of connection with another human being, brought you into the field of nursing. Is that correct?
Yes, and I found out that when I worked in business and worked with cash registers and people taking money out of the till and everything about money, and money is good, and you need to have a positive bottom line even in nursing, but there's something when you wash somebody's feet, or you wipe their buttocks when they can't wipe it themselves, that nobody ever faults you for that, for love. But if it's a nickel or a dime, somebody might turn their face and not talk to you tomorrow. But if it's about being there for them when they cannot take care of themselves, they never forget that. And that's a relationship that is established. And some of my patients that I even meet in the grocery store today, or family members of patients, still know my name or know how I took care of their mother or their grandmother as if it was my own mother or my own grandmother, and it makes for long-lasting relationships.
What kinds of personal or professional qualities, as a registered nurse, do you need to have to form positive professional relationships with other registered nurses?
Well, with others, I think that you need to always not have a power trip sense about you. Back in the day when I started out in nursing, there was a big division of power issues where the physician was the physician and the nurse was kind of looked like as the maid service. I think there has to be, a collegial team approach to getting the jobs done. Even doctors, a lot of times they need nurses, because the nurses are the center of care. They're the ones that first establish the patient relationship. A lot of times I've seen doctors who could not convince a patient to receive a certain treatment that was to their betterment because the physician did not establish that relationship. It was the nurse that the physician would come and say, well, what can we do to get this patient to see it this way, that this is a good thing for the patient. And through that rapport, out of relationship, then there's a ability to have trust. And then from trust, you can go on to other things. Where it concerns collegial relationships, it's to see that we're all on the same team and we're working for the same goals. And when we have collegial relationships, it should not be about what's good for us. It should always be what's good for the patient. And if we keep our focus on patient centered, then we can move forward. But when we look at differences and petty nuances, it can cause a conflict to providing the care that we want to establish. So I think it's about being open, it's about being teamwork and having an interdisciplinary team that works well together and that is able to goal set for our patients with the patient involvement and family involvement.
What personal or professional quality undermines positive patient and medical provider relationships, in your opinion?
Well, let's just go back to the collegial thing for a minute. Back in the day, I had a doctor at one time, and he would tell us to set up a sterile field for a patient. I want this, and I'm going to do this procedure. And I would set up the sterile field and the sterile trays and all that, and the sterile gloves. And then he'd come in and he'd say, well, I wear a size 7 sterile glove. And he'd take the tray and he'd hurl it across the room, scare the heck out of the patient, and just hurl all the sterile instrumentation on the floor. And that is not a good, collegial relationship between peers. But, when you have a relationship like that, you say, well, how do you deal with that? Okay, well, even as a young nurse, I knew you have to know your own boundaries. You have to know your own self-worth and your own self-respect. When somebody is a bully, even in the medical field amongst your peers, you have to set the boundaries, because if you allow that to happen and you don't address it or you don't say anything, the behavior will continue or it will even get worse. So what I had done at that point, when he scared the patient, and he was yelling out in the hallway and scaring other patients because everybody could hear him, I just addressed the doctor and I said, sir, now you can set up your own sterile field. If you would have told me what size gloves you wore, I would have prepared the tray that way. But your bedside manner is something to be ashamed of, and you need to work in a more professional manner. And this is reportable. I will not do anything for you in the future if you don't change your tone. Now, if you would like to ask me appropriately for those gloves, I'll be more than happy to set up the tray and get a size 7 gloves. From now on, I will make sure that you get a size 7 gloves. I said, but you will not talk to me like that in that fashion, or you'll be setting up your own tray. And all the doctors and all the nurses, of course, had their mouths gaped in the nurses' station, and everybody was aghast because everybody heard that, and he stormed off. But I guarantee you, he treated me respectfully from there on, whereas with other nurses that cowered to him or did not meet him halfway by setting the boundaries, he continued to cause them grief. So we have to be able to work with each other, and we have to also know our boundaries, and we also need to work in a professional manner. As far as the relationships with patients, you were asking again, can you restate the question, because I was still addressing the last question.
Communication is important with fellow members of the interdisciplinary team. Is that just as important, and as well as setting proper expectations and guidance for patients, as important as it is with your example of your experience that you had with your physician colleague?
Well, let's just talk about the nurse and the patient relationship. First of all, today, a lot of people are getting into nursing for the wrong reasons. I think the number one thing these days is to be honest, okay? We need to have a standard of ethics in nursing to be honest with ourselves first and then with our patients. I know a lot of nurses and doctors back in the day, they would purposely withhold information from grandma that she had terminal cancer or something like that, because they didn't want her to know that she was deteriorating or that she was going to die. Now, withholding and not being honest and forthright and upright never does anybody any favors. So first of all, I say, working with patients, you need to be honest with them. You need to meet them at their level. You need to meet them at their educational level. You need to be able to speak to them in their terms, in their vernacular, to make them understand what you're trying to say. But, as far as not telling grandma that she is going to pass away or that she has 6 months or less to live is not doing her any favors, because first of all, not talking about the elephant in the room makes the elephant just that much bigger. And it also increases the fear factor of the patient, because the patient cannot feel open to discuss what they want to discuss, because they know that that elephant's in the room and that nobody wants to talk about it. Yet, grandma knows how she feels internally. She knows that she feels very, very sick and something is very, very wrong. But nobody wants to talk about that. Everybody wants to say, oh, you're doing better, you're doing awesome. But yet she knows that she is failing, that she's doing really, really poorly, and nobody will talk to her. And therefore, you cannot address the 5 stages of death and dying. You cannot work through those stages while nobody's addressing the elephant in the room. So I think we have to be honest with our patients always. We have to be their advocate. The first thing with a nurse-patient relationship, I think, is establishing a relationship. If you don't have a relationship with a patient, then you're just about your business of hanging drips and doing tasks, but there's no connection. If you make a connection with a patient, you've made a friend. A lot of times that takes spending a little extra time with that person. Another quality I think that you have to have is good ethics.
What ethics would you believe are most important relating to your interdisciplinary team members?
Well, I wanted to talk. We're still talking about the patient, right? I'll talk about that in a minute. But as far